Hi everyone, Dr. Nemechek here, and welcome to another week in review. Just a quick reminder, hit subscribe, stay abreast of our new postings. All right, last week, 15-year-old young man, he came to us a short while ago, autism, he's pretty verbal, severe pain in hands and feet, like he couldn't be very active athletically, and what was really getting bad was this escalating, debilitating OCD and focus being worse, to the point that he was pretty much trapped in the house. It was so intense, it was hard for him to leave the house. And he was also had this like voice in his head, is the way he put it, that he was feeling kind of fearful about things. Now, OCD, as I've said, all your negative behaviors are from low blood pressure. And you release norepinephrine. It makes intense anxiety. That'll drive this OCD that you're seeing. It makes focus worse. And then this norepinephrine that's released is naturally supposed to be released in the jungle when there's tigers around. And so every time you hear a little stick break, you're like jumpy and thinking it's, tiger, tiger, tiger. And that's what he's feeling. He's feeling this like fear, like, I don't know what it is, but I'm afraid. So, very common. Put him on continuous Rifaximin, all right, fish oil, olive oil, VNS, and 6 weeks of glutamine. Right away. Cognition's better, conversing better, starting to share emotions, joint pain completely resolves. Now that joint pain was just from the inflammatory release from his intestinal tract, okay? No improvement in OCD and fearful sensations, and really so, it's May, it's been 6 months since I first saw him, and the OCD is continuing decline, okay? So that's not getting better, and I had discussions with the parents before, and they had gone back, and with their son, they realized that it started when he had his braces placed about a year ago. And we see this a lot. It could be, I talked about the dental issues, like teeth coming in, molars, just pressure, you got loose teeth, tighten in the braces. The autonomics are just so fragile, it drops their blood pressure, okay? And so we were seeing, well, maybe we could turn this around a little bit. We had added in midsummer this VNS 5 minutes a day. That didn't really help much, but I had him give some ibuprofen, and he would have for a couple hours afterwards just a dramatic improvement. So in some of the kids, you give them the ibuprofen, and the pain or discomfort or whatever the factor is that the dental issues are triggering, where the nervous system was reduced enough, they noticed a big improvement in the OCD and the focus issues. And so after discussing that, basically the plan is, the mom, I said, well, we got to get the braces off. And she's like, they're going to be off within a week. Just period. So it's a pretty common thing we're seeing. Even the Invisalign dental things can cause this problem. So focus on neurological recovery. Don't worry about the teeth. Okay? You can deal with that later in most cases. All right? So very typical kind of scenario here. And I expect when the braces come off, he'll be tons better, like within days. Okay, next, 7-year-old boy. The mom had started him on the protocol at 2. Okay, mild autism, developmental delay, just no sleeping at all, always crying, really tired. So they put him on the protocol, fish oil, olive oil, inulin, right away. More energy, more joy. He was having some abdominal pain, that's going away. Focus issues were still there. And so he's on that for a few months, and suddenly, dramatically, everything worsens. And I couldn't, by going back and talking to them, I don't know what happened. So this is pre-COVID, so it wasn't COVID. And I'm not seeing them at this point. They go and get IVIG, which is intravenous immunoglobulins, triggers severe fever and meltdowns. Just bad. And so now he's even doing worse. So now we're back into the next year. Actually, this should be May of 2020. They come and see me. I start him on cyclic Rifaximin, so he's about 3.5 at this point. Dramatic improvement in just a couple weeks. And within 8 months, so around Christmas, almost neurotypical, and he's doing well then for another year, and then he gets, or 2 years actually, then he gets COVID. And just bad, crashes. And the cyclic Rifaximin, so cyclic again is 10 days on, 20 days off. So 10 days a month you're on Rifaximin. We shift that up to continuous, plus we had VNS, starts to improve. But still kind of fatigued, still with a focus issue, so he's definitely better, but still like not crossing the finish line. So this is the beginning of the COVID era. We don't know yet about glutamine. It's a year and a half later that I start seeing the success with using glutamine in the kids and my adult patients. So we put him on glutamine, 6 weeks, dramatic improvement, but when we stopped, he relapses. That's pretty unusual, okay, but it was happening. So, but still at this point, he's now 7.5 years on the protocol. He's on continuous Rifaximin glutamine twice a day, fish oil, olive oil, VNS, doing great. Fatigue, focus, totally gone. Neurotypical kid. Okay, so doing really, really well. And then lastly, got an older gentleman, 45. About 4 years ago, he falls out of a golf cart, hits his head. Multiple small bleeds in his brain. Intense head pressure. He'd say some parts of my skull felt like it was outward, some parts of it was like a vacuum sucking him in. Horrible migraines. He'd lost his peripheral vision, lightheaded, bad anxiety, poor focus, bad concentration. So we put him on kind of standard continuous Rifaximin, fish oil, olive oil, VNS. Within 2 months, he's noticing improvements. Migraine, pressure, visual disturbances are improving. Anxiety, depression, still pretty bad. So we're now a couple years out. There's a little lapse. He's still getting the Rifaximin. He finally comes back. We add acetylcarnitine. It's something I'll use for kind of treatment-resistant depression, really, and even in PTSD. And within a short time, anxiety, depression are pretty much gone. Feels really good if he sticks with the protocol, and still some minor GI issues. He's having, like, he eats, he's got to go to the bathroom. It's kind of an annoyance for him. So this is the early days of understanding COVID glutamine. So about a year later, we start him on the glutamine. Boom, diarrhea stops. So he had long COVID on top of everything else. More energy, improved cognition. We switch him back. So now he's doing really well. We want to go from continuous to intermittent. So intermittent is going to be, we're just going to give it to you if your GI symptoms come back. That wasn't enough. He relapses a lot. So we had just switched him back to continuous Rifaximin. And he's on fish oil, olive oil, VNS. And he just wanted to stay on the glutamine. He says, I feel better if I stay on it. Doing great. All his prior neurological, cognitive things have gone away. And our plan still is we're going to go back, see if we can stop the glutamine. And my goal here is to try to constantly get rid of some things that we don't need. I should add, he's still on acetylcarnitine too down here. To get rid of things, to see if we don't need them anymore, to make the protocol simpler and simpler so that it's easier for people to be successful and take it consistently. And plus it's cheaper and so forth, less complicated. So anyhow, 3 interesting cases the last week. Hope you enjoyed that. And just remember, take care of your kids, take care of yourself, keep your inflammation down. And until next time, this is Dr. Nemechek saying, have a nice evening.